Outpatient treatment for depression in the U.S. has risen steadily in recent decades but to a level lower than expected, a new study says, indicating that costs are not the only barrier to care. Using national survey data for more than 86,000 patients from 1998, 2007 and 2015, researchers found that rates of outpatient treatment for depression rose from 2.36% to 3.47% during that period, with a rising share of treatment costs covered by insurance, particularly Medicaid. The study also showed that per-patient spending on prescriptions for depression and the average number of prescriptions both fell. Overall, the study's findings suggest that policies enacted in recent years to expand insurance coverage for mental health services have had an association with increased prevalence of treatment for depression without increasing prices or total spending, researchers from Emory University said. The study was published Wednesday in the journal JAMA Psychiatry. Nationally, spending for outpatient depression treatment rose from $12.4 billion to $15.6 billion between 1998 and 2007, an increase of about 25%, before reaching $17.4 billion in 2015. Yet annual prescription expenditures reached $603 per patient in 2015, down from $848 in 1998. While the average number of prescriptions per patient fell from 7.64 to 7.03 in that time frame. Despite recent concerns about drug costs, in the case of depression, spending on drugs has decreased since 2007, researchers said. That decrease in spending was likely due in part to multiple blockbuster antidepressants losing their patent protections and becoming available as cheaper generics in recent. The share of patients treated for depression using medications such as antidepressants, antipsychotics and mood stabilizers remained steady during the years studied, hovering around 82%, researchers found. Meanwhile, the share of patients treated through talk therapy fluctuated, reaching about 50% of patients in 2015. The study highlighted federal policy changes, particularly the Mental Health Parity and Addiction Equity Act of 2008 and the Affordable Care Act of 2010, that have helped improve access and treatment rates by reducing the cost of care for depression patients. For example, between 1998 and 2015, the share of spending on outpatient depression treatment that came from uninsured patients fell from 32% to 20%, while the percentage of treatment covered by Medicaid rose from 19% to 36%. Yet despite more widespread health coverage in 2015, disparities remained in treatment rates. For example, the treatment rate for whites was more than twice the treatment rate for blacks, and was also significantly higher for females than for males. The overall treatment rate remains far below reported rates of depression among some groups in the U.S., the study notes. From 2013 to 2016, 8.1% of Americans 20 or older had depression in a given 2-week period, according to the Centers for Disease Control and Prevention. Such gaps indicate there are substantial barriers beyond payment that keep people from receiving treatment for depression. These factors may prove to be more difficult to address from a policy perspective because clinical inertia, community stigma and other constraints are not as easily addressed as mandating parity in insurance coverage and level of generosity, researchers said.